Well, just for those of you that are on, I'm seeing a lot of very familiar names, but there are a few that I don't know in there. So for those of you that are on, welcome to today's Tech Huddle. As just a reminder, you attendees will be on mute. Just kind of keep the background noise down. Caleb and attendees, we do record these. Those then go into our members area, and so that they can live on forever and ever, and people can continue to learn from these things. So attendees, if you have questions, go ahead and throw them in the chat box. I've got that open. Caleb, as you're talking and presenting here in just a couple of seconds, I will be keeping an eye on that for you. And as those questions come in, what I usually do is I shut my video off while you're talking. And then if a question comes in, I'll kick it back on.
Perfect.
Cool. Well, I am showing exactly 9 o'clock Pacific time, 12 o'clock Eastern. So it looks like we can go ahead, and we have people that are joining now. So for those of you that are just jumping in, welcome. Today's presenter is Caleb from Boogaloo Beds. Caleb was actually at one of the tech fests that we did in Colorado. So I got to meet him in person, and I've known him for several months now, I guess. And he's got some pretty cool things. And today is the official launch of Boogaloo Beds. So I'll kick it over to you, Caleb.
Yeah, thanks, Dustin. So it's great timing to be involved in the Tech Huddle today. We've been developing this product for about 18 months, and just launched it last night. So really excited to be involved and sharing it with people. I thought a good spot to start might be with how I personally got involved with this and why I started Boogaloo Beds. And it really goes down into two different paths. The first is that growing up, I had a really good friend named Ben who had Down syndrome. And so I was his peer helper in middle school, and was the only guy at a 7th grade birthday party at the McDonald's playpen, and just absolutely loved my relationship with Ben, and got a strong affection and affinity for people with special needs, both from helping them as well as being their friend and just having a really good time with Ben. The other is that originally, so right now we're making our smart sensory beds that help us sleep, they help us safety, and they help us sensory regulation for people with special needs, with a pretty strong focus on autism and sensory processing disorder. But originally, we were actually making pod beds for any type of shared accommodation. So travel hostels, student dorms, homeless shelters, anywhere where a bunch of people sleep in a room together. And while doing that, we discovered a few things. First of all, that the product is really helpful in those situations, but it can be hard to start a business in a place where people are staying in a room where they don't necessarily have a ton of resources to afford products like this. But the other thing, which was kind of spontaneous and I'm really grateful for, is that I learned about how much this could help people with special needs. And so that actually came from a professor I had who had a son with autism. And she started using our bed that was designed for student dorms, but her son absolutely loved it from the sensory side and from sleep. He loved the cocoon-like feeling and just how it made him feel safe at night. And from there, I started to look at some of the other products online and on the internet that had been around for several decades with very little improvement and no real technology innovation in them. In my mind, they kind of look like large cribs, and they're designed to help improve really safety and elopement at night. But they're also like $10,000 to $20,000 a piece and have no technology, and frankly, they don't look like a very fun environment for the child. So we took that model and learned from what they've done, went out and interviewed over 1,000 families, met up with several different children's hospitals, including the Colorado Children's Hospital and Denver's Assistive Technology Group, and really took a modern approach to building a safety bed that can also help us sleep and help with safety, and has a really fun, kid-friendly design to it. So that's really the story of how we got into it, and I'll share my screen now and actually show you guys. I will assume you can. All right, so here's what we're building. They're smart sleep systems for people with special needs. And so really designed to improve on 3 things in someone's life. Sleep, which with kids with autism is between 50 to 80% have some type of daily sleep issue. And I don't know about you guys, but I know when I don't sleep as well, my energy is affected, I don't learn as well, even physical growth. So sleep is a fundamental building block of having good self-development as you're growing up. And there's a lot of issues with sleep, especially on the sensory side of people with autism and other special needs have a lot of issues filtering out their sensory environment. So things like sound at the night, visual stimuli within a room, too much or too little light. And not being able to properly control that environment causes a ton of those sleep issues, which cascades into those other issues in that child's life. It also has really big impacts on their parents' life too. If the kid's not sleeping, then the parents aren't sleeping and their siblings aren't sleeping. And it ends up being this really vicious cycle where everyone in the household is tired, and that means that you're more aggravated at each other, and just life is a lot harder. So by improving sleep with the kid, we can also improve sleep with the rest of the family, and that cascades into their school life, the family's professional life, even their marriage. Another big one is safety. So a couple large issues there. The first and probably most common is wandering or elopement at night. So kids actually getting out of the bedroom, or I was talking to a family a couple of weeks ago and their daughter constantly tries to open windows, and they've actually found her on the roof before, which is really scary. So being able to make sure that you can ensure that your kid is safe at night and isn't wandering around the house or getting into the kitchen or falling down the stairs. Another is self-injury. So a lot of these kids will have perhaps biting issues, or they bang their heads against things, and that injurious behavior, especially at night when perhaps the parent isn't around, can be really damaging. And so I'll get a little bit more into how we help with that, but that's another big thing that we're working towards. Then the last are seizures. So seizures can lead to self-injury if someone's limbs or their head is banging against something, or as well as simple as them falling out of the bed. The last thing is sensory regulation, and so that really ties into both of these. A lot of people with special needs have issues processing their environment. So kids with autism might be rocking back and forth or having big headphones on over their ears to help with sound. Well, the Boogaloo bed provides essentially a sensory cocoon around the bed that helps regulate the environment by, first of all, lowering sound, lowering light, lowering visual stimuli, and then we introduce soothing forms of stimuli to help that person. So those are the three main areas that we're really focused on helping. And those, as I mentioned, really cascade into pretty much every aspect of your life is affected by these three things, both for the child and for the family. So here's a little more well-rounded picture of the bed. We really worked on making it as kid-friendly as possible. And I'll get a little bit more into the individual features, but a big aspect of this is having the sensory canopy. And we really designed curves into this to make it a more friendly design, not this hard box that's in a room. And we really tried to make it look like a fun home good, not a institutional medical product. This is something that the kid's going to be using for years, potentially even the rest of their life. So we want it to be something that they really love and look forward to every day and every night. To get into some of the specific features, the core of the product really is the sensory canopy. So that's the canopy that goes over the top of the bed. It does a couple things. The first is that it helps regulate the environment. So it helps with sound, it helps with light, it helps with visual stimuli within a room. And a lot of kids with special needs, especially many kids with autism that I've met and worked with, really like small, kind of cozy enclosed spaces, especially during times of stress. I met a bunch of kids that when they're stressed out, they'll end up under a bed or in a kitchen closet because they like that feeling of being able to control their environment. The other big aspect is that the canopy is actually tensioned around this steel frame. So on the inside, there are no hard points. It's 360 degrees of padding. So if someone does have self-injurious behavior or seizures, you know that they'll be safe. We also packed in a lot of different smart technologies into this product, and all of them are controlled by either an iPhone or Android app. So a couple are motion detection, sound detection, temperature, humidity, even things like smoke alarm alerts and carbon monoxide alerts. All of these end up getting triggered to the parent or caregiver's phone. So if a smoke alarm is going on in your house, but you're actually at work, you'll get that notification and you can call home and check with the caregiver there to make sure everything's okay. The circadian light's another really fun and really powerful feature. So the way that this works is that similar to a sunrise or sunset, in the morning, it'll actually fade in light. So when someone wakes up, instead of this jarring alarm or someone bursting into the room to get them up, slowly over 30 minutes or an hour, it'll fade in more and more light. There's actually clinical studies that have shown that this improves energy in the morning by having a more natural transition into wakefulness. At night, to provide that psychological cue that it's time to go to bed, there's a sunset type function. So in that way, it fades out like a sunset, providing that kind of psychological cue that it's time to go to bed and that you should start winding down. We also even have a meditative breathing program built into the circadian rhythm light so that you can breathe in as the light pulses and then breathe out as it pulses away. And that meditative breathing, deep belly breathing, is also clinically shown to really reduce anxiety and help with meltdowns. We also have a soothing speaker. So this can help mask unwanted sounds as well as provide soothing background noises. It's anything from nature sounds to music. And we also have white noise built in and radio. And then you can even plug in your own iPhone or Android and play your own music or sleep stories or whatever you'd like on the back. We also have a monitoring camera. And so this is a 1080p HD night vision camera. So you can see during the day or you can see very clearly at night. It has two-way audio so that you can talk to the kid. Say mom's in the bedroom and she gets a notification that Timmy is woken up at 1 a.m. and she wants to check in on him, but she doesn't want to walk all the way across the house to do so because he might be just stirring a little bit. Well, she can check in on the camera, and then if Timmy is agitated, she could actually talk to him through the two-way microphone and he can talk back. It also provides recordings, and those recordings can be based on sound or motion events, or just continuous 24/7 recording. And we think that there's going to be a lot of benefit, not only for the kind of monitoring aspects, but for actually understanding what's happening during the night. Many parents might not know that their kid is having a seizure at 3 a.m. or that he has very restless legs throughout the night. And so that parent can then take these video recordings, show it to their doctor, and actually prove that, hey, he is having these issues at night. We need to do something about that, whether that's a new medication or a type of therapy or a change in his environment. Both of these work with Amazon Alexa and Google Assistant, so you can view them from your TV or from your Echo Show or really any device in your house. Another big issue we've also seen with a lot of the current beds on the market is that there's a lot of entrapment issues. And so the FDA has actually put out guidelines of the 7 zones of entrapment. And so the most common one that we've seen with these types of beds is kids, especially if they have low muscle tone or perhaps have cerebral palsy and can't pull themselves up, they get caught in between the mattress and the sidewall and can lead to injury. And so what we've done is we've created zippered safety sheets. They zipper into the sidewall of the bed above the mattress, so there's no potential way for someone to get entrapped. And it also makes cleaning up much easier if someone has an incontinence issue. None of that's going to go inside the fitted sheets and you have to dig into these gross corners. It's all just going to stay on top right with that safety sheet. And the final thing is that we've spent a ton of time on the actual details of this bed. So the steel frame can hold over 500 pounds. You can set it up in under an hour with one adult with one Allen key. Myself, I've set this up in 27 minutes is my current record. So it's very, very quick to set up, really easy to break down, ships in just 3 boxes. Spent a lot of time in that to make sure that it's easy if someone has to move houses or to make sure that it's safe as well. The other big thing is the fabric in the product has been very rigorously tested. It's bleach cleanable. So if someone does have an accident, you can spot clean it with bleach. You can toss it in the washer and machine wash it. It's really, really easy to clean and to fix up.
Hey, Caleb.
Yeah.
We actually had a couple of questions come in. As you were talking about the sheets, there was something in the chat that somebody had said that when she was direct care, that the mom of the person that she was serving would actually sew the fitted sheet on a bed to the other sheet, and it sounds like you've kind of designed your sheets in a very similar way, right? Where there's one for safety, but also for ease of.
Yeah, it's very true, and I'm guessing. So we did this. The main reason or motivation was for safety, but after building it, I learned a lot more that a lot of these kids have issues with bed stripping as well, and so they just love to strip everything off their bed and kind of have some fun with that. But with this design, there'd be no possible way for that to happen.
And then what is is the camera, I'm assuming, just connected to Wi-Fi so that the camera in the bed is connected to the Wi-Fi in the house so you can access the video feed from basically anywhere. It's not like a nanny cam that has a certain range, right?
Yep, that's correct. It goes through the Wi-Fi, so you could do it from your bedroom, or say you're traveling on a business trip to California and they're in New York, you could still see it from there in real time.
Okay. And then the other question that came in was, do you see this bed being used for adults? You had mentioned, I think at the very beginning, that obviously that for a child, but could be used throughout their life. Do you see adults using this? And then what about the camera issue with the adults? And
yeah, 100%. We very purposefully designed this around a full-size mattress. And so that actually fits me. I'm about 6 feet tall and I can fit in it very comfortably. We see many kids would potentially need this for the rest of their lives. The hope is that a product like this, they can graduate out of. And so over time, you rely less on the features in the bed and they can slowly get to a regular bed would be the ultimate goal. But some people might need something like this for the rest of their lives.
Sure.
The camera concern is definitely valid. And so if you get to a point where the camera is not useful, or maybe you don't even want it, very easy to remove it. You can just unplug the power cord or actually remove the camera itself, and then you don't have to worry about it.
Great.
You could even take that camera and use it somewhere else in your house if you wanted.
Good idea. All right. Thank you.
Yeah. So I think the one other really critical aspect to talk about is funding of this product. So right now, we're priced at about $5,000 per bed for cash or for waiver payments. That's our launching price, so that might change a little bit in the next couple of months. But we understand that that is pretty expensive. It's a lot to afford for some families, even if these are some of the biggest problems in their lives. So we spent a lot of time working on figuring out several of the different funding options. Medicaid waivers are one of the most common that would cover this under either assistive technology, medical equipment, or perhaps in some cases, home modifications. That's going to change state by state and even where in the state you live. So it's best to work with your service coordinator or case manager to actually figure out where it would fall, what your budget is, and how that actually works within your state. But we're very glad to work with anyone and help them understand how this works from our side, how we ship it to you, what the setup process looks like. So if you are interested in working through a Medicaid waiver, feel free to reach out with us, and we're happy to collaborate with you and your service coordinator on that. Another big one is Medicaid or private insurance. So this is a medical device. It's durable medical equipment. And so this also changes a little bit based on your insurance provider or which Medicaid coverage you have under which state. But in many states, they will cover this with a prescription from a doctor, note of medical necessity, often either from a doctor or from one of your therapists, and working with a durable medical equipment provider. So it might be the person that you get your power wheelchair from or other medical equipment, and they can bill insurance. If this is the case and you're wanting to do this, typically the way it works is that you need some type of fairly severe safety concern. So that could be that constant elopement or wandering, seizures or self-injurious behavior, self-harm issues. Those are some of the most common to be able to get this covered. Just sleep, unfortunately, insurance is a little bit less likely. From their perspective, if the kid's going to get hurt and they're going to have to end up paying for him getting hurt, they would rather buy a product like this that helps prevent and keep it safe than go down that route. The other is that there are quite a few grants from companies and charities that will fund products like this. And then the last is that we do offer financing. So up to 6 months of financing right now through PayPal, which is a very commonly used financial service provider. And they can offer interest-free 6 months of financing for the product, which can make it a lot easier for people to work through. That's most of what I have covered today. I see we have a couple more questions, Dustin, and as well, I'm happy to, I've got the bed right outside, so I could give a little in-person tour too.
Yeah, let's do it. There was a question that came in and said, what makes your product a little bit more unique from other companies?
Yeah, it's a good question. So there's quite a few different enclosed bed products on the market. So you might have heard of Beds by George or Sleep Safe Beds or Safety Sleeper. And pretty much what all of them focus on is safety via confinement. So keeping someone in a space, keeping them safe. And the way they do that is they have an enclosure or large bed rails or some aspect like that. Our product also does that. So we have the canopy that goes around, and that can be an enclosure. But really, we're trying to take that a couple more levels past that. So from the safety side, the camera and the safety notifications, we hope that that's a stepping stone away from just relying on this enclosure. So as someone becomes more independent and has more autonomy to get around the house and you're sure that they're safe, you can stop relying on the enclosure to keep them in this space and just rely on the camera and the notifications to see if they're actually safe in bed, and it gives you an alert if they get out of bed. The other big side is we have a lot of sensory technology packed into this. So we've got the circadian rhythm light, we've got a speaker, we've got the sensory canopy. We can even do add-ons like a weighted blanket or vibration mat. None of the other products offer anything on the sensory side, and we think that that's a huge aspect of sleep, of improving meltdowns, and from a safety side, if someone can't necessarily hear that sound from downstairs that they're curious about going to check out, then they're not going to be getting out of bed and getting into trouble or potential harm as often.
And I think I did just see another question in the Q&A that I wasn't paying attention to, so sorry, Jessica. And I think you just answered this question, but I want to make sure we get Jessica's question asked. Can you give it just a kind of the flow of what it would look like if a child gets up out of the bed and is, exiting the bed? What does that look like for the parent? What do the notifications look like? What do they then do to validate that that is happening, and just kind of walk through like a use case?
Yeah, definitely. So the way that that's going to work is there's two ways that this triggers notifications through the app. The first is through movement. And so that's basically a percentage of pixels that change in the image. So if the camera is seeing that there's no movement for a while, and then all of a sudden there's quite a bit of movement, it'll trigger a notification to your app on your phone. And you can set that up to actually make a sound at night or to vibrate or to do whatever you'd like. The other is through sound. So it also has a sound trigger that if there is a certain sound in the night, maybe the kid's yelling, that will also give you a notification. From there, you could just get up and go check at that point. But if you are feeling lazy and you're still in bed and feeling comfortable, you can check on the camera really quickly. It's a live stream. So just pull that up. You see, oh, he's just kind of playing around in bed for a little bit. He needs 10 minutes to calm down and he'll be back in bed. That's fine. The other aspect is that if he is really agitated, you can actually turn on that calming music or that cool down light or that meditative breathing program. And so you can trigger the ability to actually soothe and calm down from those sensory elements. And the last part is, of course, you see that they're still agitated and they're needing you. You can then go and actually check on them and make sure that they're okay.
I think it'd be great for a parent that travels frequently to feel like they're still involved in that kind of day-to-day care of their child.
Yeah, definitely.
Great. Well, Caleb, I don't want to interrupt you, but I just we are getting close to time. So anybody out there that has questions, now's your chance to get them in. And Caleb, I'll let you continue.
All right. Do a quick in-person tour here.
While you're getting over there, I was actually considering how can I do a tech huddle at CES, like walk around, and I actually looked into hiring a camera crew to come in and just like follow me around and like broadcast CES live, but it was way above my skill set at this point. Maybe next year.
Well, it's probably better than just holding my laptop doing a little selfie camera right now, but
it works.
So we got to zoom out quite a bit, but here's the bed. So you can see we really incorporated a lot of like curves into the top of it. That's the other thing we found, is that a lot of the products are pretty medical and institutional looking and very boxy. And so we wanted something that looks really kid friendly and people want to be in. Also really tried to build in kind of a smiley face design. So we've got some eyes up top and a big zipper smile, and kind of looks goofy and fun like that. There's 2 layers. So some kids really like a full kind of enclosure where it's more of like a tent, and that would just be the fabric. And then we also have some really strong durable tension mesh here if someone wants more of that as well. The fabric itself is really breathable, so both aspects work. So this is actually the inside of the bed. So you can see here's the zippered sheets. So they zip right into the sidewall. There's no way that someone could either take them off or get caught in that. This is the actual, here's the camera and the light and then the sensor system. So this camera right here, that's what does the live recording and mic. This is their circadian rhythm light, as well as the speaker. So those are both app controlled, as well as if it's on, you'd have control panel here, which can be covered. And then this is the humidity and temperature and sound during the night sensor, which are also really important. I live in Colorado. When I first moved out here, I had terrible congestion every morning because it's so dry. But someone that's nonverbal might not actually be able to tell you that, hey, the humidity in my room is way too low. I wake up every morning really stuffy. By actually using that humidity and temperature sensor, you can understand what's the optimal environment for my kids so that they can get the best sleep and rest possible.
We actually, Caleb, while you're there looking at that camera, can a parent that's obviously looking through the camera, can they communicate with their child through it to do soothing themselves?
Yeah, so there's a two-way microphone. So the parent can talk through it and the kid can actually talk back as well. And that all
About
goes
like a recording, could that be pre-recorded and parents hit a button, or I don't know.
I don't think that's possible at this
Question
point.
came in.
Yeah. It's a good suggestion though.
Yeah. Cool. Thank you.
Yeah. So yeah, kind of last part is that everything's tensioned. So there's no hard points on the inside. It's all really nice. We've got a pocket here that's removable. So if the kid shouldn't be maybe having a pocket that they can play with at night. And then we also have two ports on each side that would be used for feeding tubes, oxygen, or electronics. So you want to charge an iPad in there, you can run it through there, or feeding tubes or other things like that.
You know, actually, I got to, not to interrupt you again, but when Caleb set this up, he actually brought it to the Tech Fest that we did, and he was saying how fast it is to set up. I mean, he unpacked it and had it up within 20 or 30 minutes there in the conference. So it's looked very simple. And actually, I got a chance to get in the thing, and it was comfortable. You know what it reminded me of? When I was a kid, and I used to make, like blanket forts.
Yeah.
And that was like your little escape place. And when you were in there, I'd bring a radio and lights and stuff. It's like your own little environment that felt protective, even though it was just a blanket. And so it really does give that person that sense of, I hate to do this, but like being in a cocoon, no safety,
Yeah, very much so.
And it was comfortable.
The blanket fort idea is, very much a concept that we kind of thought about a lot when we were designing this.
And it looks like we do have another question. Can their whole gauge be larger for many? Can the whole cage be larger for mini tubes?
Mm-hmm. Yeah, we could definitely do that. This is pretty standard for like feeding tube size, but if you wanted a larger gauge, we could do that as well. Be pretty easy to add.
Great. Well, any other questions? Go ahead and get them in pretty quickly. Caleb, really appreciate you doing this. We're excited to be one of the first ones to see this on your official launch day yesterday.
Yeah.
Last night. Yeah. I woke up and I saw the email and I was like, oh, perfect timing. We're doing a tech huddle.
Yeah, it coordinated really well, and thanks for having me on.
Yeah, and I want to congratulate you. Right? I know that the road that you went through to build this and it was probably not easy. So congratulations on getting through that part, and wish you the best of luck for what you're going to be doing next part of your journey with this company. So
yeah, thank you. I appreciate it.
Cool. All right. Well, thank you all for joining us. And again, if you want to watch the recorded version of this or past tech huddles, you can go check that out in our members area. Just go to disabilitycocoon.com, and would really recommend go follow us on Twitter and Facebook if you aren't already, because I'm going to be pushing out a lot of stuff from CES today and tomorrow. Just get some ideas from us. So Caleb, thanks again. Really loved the kind of getting in the bed there. That was a cool way to end this. So